Hey everyone, I just wanted to put together a short video which shows our lower extremity slash hip slash lower back protocol with regards to ART. These moves aren't the same for every patient. Sometimes there's a few more or a few less depending on the signs and symptoms of the patient, but these are our basic protocols. So with active release technique, we want to start by shortening the muscle, contacting the muscle, and then elongating the muscle underneath our contact. Here, Simone, one of our physical therapists, is allowing me to show the protocols to you guys. We're working on Glute Max, so that's one of the big primary hip extender muscles. We start by shortening the muscle, contacting it, and elongating it. Because it's such a large muscle, we have to do several passes in order to get the full scope of that muscle. From there, we get a little deeper into a muscle called the Glute Medius. Your Glute Medius muscle is one of the external rotators, and it's a primary muscle with regards to locomotion and movement and gait. We use a green stretch strap in order to facilitate some of that external rotation so we can slacken up the big glute max and get a little deeper into your glute medius muscle. And here the strap has come loose, but I'm just assisting Simone in order to get a full stretch. And that will happen at times with our patients with regards to their inability to perform the motion effectively and efficiently, and we will have to help them. Okay, from there I'm going to shorten the patient's hip flexor muscle, cue them with some audio cues, explain to them what I'm trying to accomplish, and from here we're getting into the hip flexion or hip flexor muscle called your psoas, which consists of both iliacus and psoas. So here the patient is shortening the muscle, I'm contacting it, they're elongating the muscle and extending their arm in order to get a full lengthening of that muscle. With active release technique, we talk about the last 10% of the motion is where you get 90% of your stretch, and it is important to kind of give the patient audio cues with regards to what they need to do in order to get a full stretch out of that muscle. Again, another rather large muscle. From here, we're getting into the back of the hip flexor muscle, a different muscle called the Quadratus Lumborum, and this is another primary mover with regards to the ability to stabilize the hip during certain motions and movements of locomotion and any kind of sporting activity. Patients usually get a tremendous amount of relief from this stretch. Let me see. From there, now we're addressing some of the rotation muscles of the lumbar spine. And again, I'm cueing the patient. They're actively assisting the motion while I perform the active release stretch. I think that's one of the critical components of active release technique, is allowing the patient to assist in the stretch of these muscles. If you notice, we're working in multiple planes. So we work flexion, extension, lateral flexion, rotation. So we're trying to get our hands on as many of these muscles as possible. Thank you.